Good evening. My name is Olivia Galloway Sanders. I am currently attending Herzing University, obtaining my MSN with a concentration in FNP. This PowerPoint will elaborate on peer review opportunity focusing on COPD. Objectives. This PowerPoint will discuss the introduction, quantitative, qualitative question, background, description of condition, COPD among those who smoke, interventions, management, therapies and risk, ethical considerations, HIPAA informed consents, methodology, findings, funding, summary, and references. Introduction. Chronic obstructive pulmonary disease, better known as COPD, presents breathing difficulties as a consequence of the obstruction of the airflow from the lungs. Some of the most prominent symptoms of COPD include, but they are not limited to, wheezing, shortness of breath, recurrent respiratory infections, fatigue, and cough. COPD accounts as one of the leading causes of morbidity and mortality across the world and the fifth leading cause of death in the U.S. Quantitative and qualitative question. PCOAT question pertains to study of minors who smoke. The qualitative and quantitative PCOAT questions for this research are as follows. Quantitative question. Amongst miners in Fort Knox Gold Mine, Alaska, does a decrease in cigarette smoking as opposed to an increase in cigarette smoking results in decreased COPD prevalence? Qualitative question. Amongst persons suffering from COPD in Fort Knox Gold Mine, Alaska, does early detection in comparison to late detection lead to improved outcomes? Background. This slide will talk about primary cause, other causes, and minors. The primary cause of COPD is smoking. Individuals that continue to smoke make their chronic bronchitis and emphysema worse, which impairs the effectiveness of corticosteroids. However, occupational and environmental exposures such as noxious gases, vapors, dust, fumes, or other chemicals tend to increase the risk of COPD. Description of condition. 4 stages of COPD. COPD is a lung disease that makes it very difficult to breathe. COPD can also be caused by secondhand smoke, which accounts for about 25% of COPD cases. There are 4 stages of COPD. The first stage is mild, which is the stage where you have limited airflow. This stage generally goes unnoticed. The second stage is moderate. The airflow starts to get a little worse. Individuals find themselves getting short of breath during activities. The third stage is severe. The airflow and shortness of breath is worse. Individuals can't walk or do normal activities. Individuals will encounter frequent flare-ups, better known as exacerbation. The final stage is severe. The airflow is very limited and the individual has frequent recurrent flare-ups. The individual quality of life is classified as poor in this stage. COPD among those who smoke. Teenage years, older than 40. COPD research has been noted to increase with increased rates of smoking and increased age. Because most smokers start from a very young age, generally teenage years, it is important that young people are given the right information about the dangers of smoking or else they will likely end up with the disease. In another research, study showed COPD to be 24.3% prevalent among smokers who was older than the age of 44. The researchers came up with a profile for the typical COPD patient. They reported that the patient was frequently a male, older, had a low BMI, a long smoking history, had been previously exposed to irritants such as smoke, had lower educational level, and often had cardiovascular comorbidities. Interventions, cessation of smoking, and education. The leading intervention that is implemented with COPD individuals is the cessation of smoking. By ceasing to smoke, reduces the development rate of the disease and could possibly reverse symptoms. When individuals are educated on the symptoms and the effects cigarettes will have on his or her life, some individuals tend to become motivated to stop smoking. Research has shown that COPD patients who ceased smoking had higher abstinence rates than COPD patients who did not cease smoking. Management, purpose, goal, controlled trials, medication. The purpose and goal of COPD management is to improve the individual's quality of life and functional status by reducing symptoms, preserving lung function, and reducing the possibility of exacerbation. Randomized controlled trials have shown that proper COPD management, including elements such as therapy, patient education, and follow-up by case manager, can help to reduce the number of emergency department visits. There are a number of nicotine addiction replacement methods, including the use of nicotine patches, antidepressant drugs, and so forth. They help patients to stay away from smoking. However, it has been noted that these methods do not help patients to stay away from smoking for long. Therapies and risks. New drugs addressing issues at hand. There are several new drugs that are being developed to help with nicotine addiction. These are more promising than the current available versions because they alter neurotransmitter systems found in the brain nucleus accumbens. These systems are known to be involved in the reward response of the brain when one smokes. One of the biggest risk factors in COPD is smoking, and addressing this factor may be a sensitive issue for some patients, especially if they feel they are being told how to live their lives and do not feel like they have full patient autonomy. Of course, there are also other risk factors that include long-term exposure to pollutants, fumes, or dust. The principles of justice, beneficence, and patient autonomy, for instance, respect for a person, has to be considered at all times. Ethical considerations, evidence-based practice. The best practices for treating COPD depend upon the grade of the COPD. Bronchodilators, inhaled steroids, combination inhalers, oral steroids, phosphodiesterase 4 inhibitors, theophylline, and antibiotics may all be used depending upon the grade or severity of the COPD. Other options exist, however, such as surgical procedures, placebo controls, and drug withdrawal designs, though these do also have their own ethical issues that must be considered for the patient being treated. HIPAA informed consent, health medical records, requirements of informed consent. Health medical records are protected by HIPAA and FERPA, respectively, and thus individuals' information is protected by law from being accessed by individuals who do not have permission to access that information. Obtaining that permission can only come by way of informed consent, which means that the participant in the research must be informed as to what the records will be used for, and they must give their permission for the researcher to use them. The components of informed consent include that the participant having the ability or the capacity to make an informed decision, meaning the participant cannot be under the influence or incapacitated when being informed about the research participation. The provider or the researcher has to disclose exactly what is happening in terms of the research. For instance, what procedures will be used and why, what the benefits of the process are, and what the risks are as well. The participant also had to be informed as to the likelihood that the process will either have benefits or risks. Methodology, current research, and participant. The current study hypothesizes a positive relationship between the rate of smoking and the prevalence of COPD. As well, the study assumes that early detection of COPD optimizes the outcome of COPD interventions. The current study proposes to undertake a cross-sectional study of miners in Fort Knox gold mine, Alaska. Participants would self-report their smoking history with the non-smoker participant. Undiagnosed COPD imposes an economic and health burden among the general population in the U.S. The study finding will inform policy on the significance of comprehensive care coordination for COPD patients, as well as strategies to control and prevent the prevalence of tobacco smoking in the U.S. Ethical principles in research are paramount to ensure the protection of interests of the research participant and protect the integrity of methodological approaches. Findings: understanding the impact of smoking, linking smoking to COPD, evidence from study. Our current study is beneficial to the miners who work in hazardous conditions and are prone to COPD. While there are many ways of them to get COPD from their working conditions, it is vital that there is a differentiation in place. This way, the miners will understand the impact of smoking and working in the mines. By having a direct link relating COPD to smoking, becomes easier for doctors and other healthcare professionals to demonstrate to the smokers the dangers. The results of the study will be beneficial to them in the performance of their work, as they will now have evidence that supports their suspicions. Using the study results, the practitioners are able to support their diagnosis, and they can comfortably diagnose patients with COPD that is related to smoking. Smokers will also benefit, as they will be given interventions that have the backing of evidence, and there is a high likelihood that most of them will stick to the interventions offered. The results will definitely increase the numbers of programs that are put in place, especially within the area, to encourage people to quit smoking. Understanding the impact of smoking on a person's health will give the individual the opportunity to make amends and opt for a healthy lifestyle. Funding, organizations, application. A project of this magnitude should be well funded for it to be successful. There are many organizations that can offer funding for projects, and one needs to search online for the appropriate organization that has support for controlling and preventing COPD. Identifying a scientific organization that has interest in a particular topic proposed for research is the first step for any research funding. Applicants should never just apply to one organization due to other applicants also applying for funding. Application for proposal consists of a draft proposal of what one intends to study and the duration of the study. It would be wise for the applicant to elaborate on the impact effect that the study has on society and how it will be beneficial for society. It is imperative to demonstrate to the organization how vital the study is. This sometimes increases the chances of receiving funding. Application for funding should always include the budget for the project. Summary: COPD has found to be one of the leading causes of mortality and morbidity in the world. It is considered to be the fifth leading cause of death in the U.S. With these statistics, it is vital that we investigate the major causes of COPD and strategies that can be used to control and prevent the COPD. While there are numerous studies that have been conducted looking into the impact and causes of COPD, there is more than enough research that links smoking to COPD. We aimed at identifying if there is any direct link between smoking, minors, and COPD. Minors are exposed to occupational gases, dust, fumes, or chemicals, which might increase the risk of COPD. However, the number of minors who smoke is also high. This means that COPD in minors could be due to numerous factors, and without establishing the actual causes, it is hard to control or prevent the condition. Understanding the underlying causes of COPD in minors will assist in developing strategies that can be used to prevent and control the disease. Thank you for your undivided attention during this PowerPoint.